I want to bring you a tale of two states and a tale of two health systems. As we go to air tonight, there's just over 760 people in hospital with COVID in Victoria. In New South Wales, it's over 2,500 people in hospital with the virus. In Victoria, elective surgery remains banned under the Andrews government's drastic Code Brown direction. Yet in New South Wales, where there are more than 3 times as many COVID patients, as I said, in hospital, they're resuming elective surgery. In other words, New South Wales residents suffering in pain will get the treatment they need, but in Victoria, they remain locked out. Dr. Adrian Trivett is a leading surgeon and the Victorian Chair of the Australian Orthopaedic Association. He joins me now from Melbourne. Dr. Trivett, thank you for your time. The New South Wales government can walk and chew gum at the same time, it would appear. They've got 3 times the caseload in hospital. They've got elective surgery coming back. Why can't it come back yet in Victoria?
Well, we don't quite understand, Peter, to be honest. We understand there's 29,000 acute beds in the state of Victoria for taking care of patients. And you've just pointed out there's less than 800 patients in hospital with COVID at the moment. That's just over 2% of the hospital beds in Victoria are being used for the COVID response. We don't deny that it's a massive problem. It's been a huge load on nurses and doctors, but it's isolated. It's isolated to big public hospitals, while medium and small hospitals and the private sector is grossly underutilised. There's capacity with nurses, hospital beds and operating rooms that are lying empty at the moment. And we think we can do better. We think we can engage with the government in trying to make a more sophisticated or nuanced approach rather than this blunt tool of on or off with elective surgery.
Yeah, well, talk to me about that term elective, because I mean, we use it, but people think then that perhaps it's not essential, you know, it's a lesser order surgery. It's certainly not emergency and it's maybe not urgent, but these people aren't well, many are in pain. Give us some examples of the procedures that are currently banned in Victoria.
I think you're right, Peter. I've used it myself today, but the word elective surgery is actually a nonsense. Patients aren't electing to have an operation. These are essential procedures. They're necessary surgeries. They may not be urgent or life-threatening, but they're life-improving. This is about taking care of patients' quality of life. They're disabled with pain. They're disabled with disability and inability to work, walk. It's having a huge impact on patients' mental health. It's having a huge impact on families. It's on business. It's really widespread, and it's unfair to patients to continue with this blanket ban when we believe there's empty and unutilised capacity in the system, and we think we can keep working in parallel to, not in opposition to, but in parallel to the COVID response, which is necessary, and it's a drain on the system, but it's not the whole system, and we think we can do better.
Give me a sense of what surgeons like you are doing if you're not operating on these essential case patients. If you've been stood down, if the whole system's mothballed, what are you doing?
Well, what we're trying to do is advocate for our patients who are suffering. They're in pain and you know, they're the ones that are missing out. This is not so much about what surgeons are doing, but it's about us trying to advocate and care for our patients. That's what we want to be doing. We're seeing patients, but we can't operate on them, and it's frustrating. I've seen patients today and yesterday, and they go on a pile, and the pile's getting bigger. The pile in my office is big, but there's hundreds of surgeons across the state that are laying fallow. They're not being utilised. The operating rooms aren't being utilised, and the public hospital waiting lists are exploding. So it's a crisis, and what we want to do is help. We don't want to argue with the government. We want to help the government have a more sophisticated approach to this.
How much listening is the government doing?
Look, until recently, they haven't been asking or listening. I think there must be a change in mood with the pent-up frustration that patients are having, the pent-up frustrations that doctors and nurses, to some extent, that they're not being utilised efficiently. This Code Brown was indicated that nurses would be redeployed to emergency areas. There's hundreds of nurses not being utilised, and to my knowledge, they're not being redeployed. And there's large hospitals in Melbourne that their capacity has not been utilised. Less than 10% of the hospital capacity, operating room capacity at my hospital was utilised last week to try and assist the public sector.
Well, keep up your advocacy. We'll keep up the fight here on the show. Dr. Adrian Trivett, thank you for your time.